How do you adjust CF enzymes for different meal sizes? When managing cystic fibrosis, adjusting pancreatic enzyme replacement therapy for different meals is key to proper digestion. It all starts with understanding how much fat is in each meal and how much your body needs. Enzyme doses are usually based on the amount of fat you eat or your body weight. For example, for older children and adults, the typical starting point is around 500 to 4,000 lipase units per gram of fat. On average, many people use about 1,800 lipase units per gram of fat. Alternatively, dosing can be calculated as about 500 to 2,500 lipase units per kilogram of body weight per meal. It's important not to go over the maximum dose, which is generally about 2,500 lipase units per kilogram per meal or 10,000 lipase units per kilogram per day, to avoid potential side effects like fibrosing colonopathy. For full meals, you start with the full dose based on the meal's fat content or your weight. If you're having a snack or a smaller meal, you'd typically take about half the dose you'd use for a full meal. This makes sense because snacks usually contain less fat and volume. Remember to take your enzymes with every meal or snack that contains fat, whether it's meat, dairy, bread, or desserts. It's best to swallow the capsules whole with a cold or room temperature drink. Do not crush or chew them, as that can damage the protective coating and reduce their effectiveness. Monitoring how you feel is also important. If you notice symptoms like greasy stools, abdominal pain, or weight loss, your dose might need adjusting. After making changes, it's recommended to follow up within 5 to 7 days to see how your body responds. If symptoms persist, your healthcare provider can help you increase the dose cautiously, but always stay within the recommended limits. For example, if you weigh 30 kilograms and eat a meal with 20 grams of fat, you might start with a dose calculated as 500 lipase units per kilogram times 30 kilograms, which equals 15,000 lipase units. Or, based on fat content, 1,800 lipase units per gram of fat times 20 grams equals 36,000 lipase units. The actual dose should be tailored to your response and symptoms. For a snack with half the fat, you'd take about half the enzyme dose used for a full meal. Safety is important, so avoid exceeding the maximum recommended dose to prevent side effects. Always keep in touch with your healthcare team to ensure your enzyme doses are appropriate as your diet or health status changes. In summary, adjusting enzymes for different meal sizes involves estimating the fat content, calculating the dose accordingly, and monitoring your symptoms. Smaller meals or snacks requiring proportionally smaller doses and regular follow-up helps keep your digestion on track. Remember, each person is unique, so work closely with your healthcare provider to find what works best for you.